Good afternoon to members of the media and the listening public. Today I am joined by Chief Medical Officer, Dr. Ayo, and we are quite pleased to welcome our guests from the Caribbean Public Health Agency, CARFA. They have been here this week to facilitate executive information and training sessions that will assist us in reestablishing Bermuda's tourism and health program. The Tourism Health Program is designed to strengthen visitor-based surveillance in Bermuda whilst protecting the health of visitors and residents. Welcome to Program Manager for Regional Tourism and Health, Dr. Lisa Inda, and her colleagues. We are grateful to have you here in Bermuda. The meetings you have held and the training sessions have benefited all who have attended. Your expert advice and technical assistance on the prevention, surveillance, and rapid response to communicable diseases, including the food safety and health and safety in tourism, will enhance our understanding and awareness of the CARFA Tourism and Health Program. In 2016, the Ministry of Health partnered with CARFA to improve health and safety for tourists and the local population through participation in the Regional Tourism and Health Program. The ministry was supported in this endeavor by the Ministry of Tourism, Transport, and the Bermuda Tourism Authority, the Bermuda Hotel Association, and various other stakeholders. At this time, Bermuda was preparing for the 2017 America's Cup. Increase in visitor arrivals amplified the potential for visitors and locals to transmit diseases to one another. This collaboration helped us to prepare for and manage any health and safety threats. Unfortunately, due to the pandemic, the program has not been the focus over the past 2 years. But we are now in a better position to get back on track and revamp our program. This program will not only protect the health and safety of Bermuda's visitors and locals, but also protect our reputation as a healthy and safe destination. Travel and tourism is a critical industry for Bermuda. After 2 long years of the coronavirus pandemic and the havoc it has wreaked on the entire world, health, safety, and economic development are essential. As a result of the pandemic and the collapse in travel, Bermuda's tourism and travel industry recorded the most significant job declines of any industrial sector in Bermuda, with losses of 696 field positions in 2021. The return to pre-pandemic job levels will heavily depend on the success and recovery of Bermuda's tourism industry. And our tourism industry depends on the work this government is doing to facilitate its success. I am pleased to see the vital collaboration gathering momentum again. It will strengthen our tourism product, it will give us a competitive advantage, and most importantly, it will improve the health, safety, and health security for all of Bermuda and our visitors. The CMO will speak directly about this week's meetings and training, and I am also inviting Dr. Inda to provide additional information on the CARFA Tourism and Health Program. In closing, I do want to note that the funding for this visit was graciously provided by the European Union through the 11th Economic European Development Fund and the U.S. Center for Disease and Control and Prevention. On behalf of the government of Bermuda, I thank both organizations for their support. Thank you again to Dr. Inda and our team from CARFA for your expert advice and technical assistance this week. I encourage you to continue your efforts throughout the Caribbean on this important program. Thank you.
Thank you very much, Minister. Good afternoon, Bermuda. So the Travel Health Program is a unique program set up by CARFA, the Caribbean Regional Public Health Agency, to protect the health of visitors and residents across the Caribbean. It does this by enhancing the vigilance for communicable diseases in the tourist-dependent economies of the Caribbean. As the minister stated earlier on, Bermuda was one of the first to get on board this. Unfortunately, because of the pressures of the pandemic, we have we've not really kept it up, and this is an opportunity for us to relaunch this. So we have invited government and other stakeholders to participate in the training for this throughout the last 3 days. So from Monday, 25th of July through to today. We've had 3 days of very fruitful and very encouraging discussions and training, as was excellent opportunity for participation and contribution across both public and private sectors, and the relaunch of this program, as I previously mentioned. So we started off the week with a meeting with the coordinating committee to clarify, understand expectations, and also to iron out a few kinks that we had. The CARFAR team met with the coordinating team and also the representatives of the Ministry of Transport, representatives of bus drivers, taxis, associations, minicabs, ferry operators, and boat operators across the island. And we had a very interesting and fruitful discussion on how we can enhance our tourism product. We also met with key leaders from the Ministry of Health to get the buy-in needed to relaunch this program. In addition to that, we met with key tourism stakeholders, the hotel associations, members of the chambers of commerce, the employers council, and also with the Bermuda Tourism Authority to understand the unique needs of business and how business can both participate and benefit from this. We ended the day with a bigger stakeholder meeting, mainly government stakeholders, including immigration, customs, the port health teams, the airport authorities, shipping agents, and also the unions, to inform everybody of what we have in mind, and also to take contributions and fine tune the relaunch of this program. The next day was a day of training where we met with colleagues and representatives from all the sectors, from the hotels, from the Chamber of Commerce, from the restaurants, bus drivers, ferry operators, independent tour operators, the hotel inspectors, environmental health, and we trained on the travel health information systems across board. So a total of 80 people were trained and participated in some form of or the other over the course of 3 days. What do we hope to get from this? This is the aim is to make Bermuda's tourist product more attractive, more competitive, resilient, and sustainable. We want to make sure that through the surveillance measures we're putting in place, we're improving the overall health of both our visitors and our residents in Bermuda. And we want to strengthen Bermuda's public health framework to support tourism. We're doing this by linking up with the regional bodies, CARFA, and also other partners who would help us in any other public health response. What are the next steps that we intend to do as a result of the 3-day meetings? We have introduced the Healthier, Safer Tourism brand to our partners, and it's been well received. So we're going to promote that and get certification for all our partners for healthier, safer tourism. As I mentioned before, we introduced the travel health information systems to our partners. I'm going to roll that out over the next couple of months to make sure that all of our partners are able to use that and derive the benefits that we expect to get from this. Over the next couple of months, we're going to have increased links with stakeholders in tourism, the Chamber of Commerce, and the hotels. And also other accommodations, including Airbnb and the likes. And this is going to make sure that we have complete buy-in from everybody to make sure that this actually works. To make this work, we're going to be identifying dedicated staff who are going to monitor this and are going to make sure, operationalize what we have planned. So that's what we hope to get out of this and the next steps we want to take. The next thing for me to do is to introduce Dr. Inda, who's the Director of Surveillance, Disease Prevention and Control Division of the Caribbean Public Health Agency. Dr. Inda leads the Regional Tourism and Health Program. This is an innovative program that is addressing the health, safety, and environmental sanitation threats to tourism, with the aim of strengthening regional and national health systems to enhance the health of visitors and locals, and thereby promote sustainable tourism and economic resilience. Recently, under Dr. Inda's guidance, the regional guidelines for resuming travel to the Caribbean and a comprehensive package of proactive COVID-19 tourism measures to build assurance amongst travelers that the Caribbean is a safer, healthier choice as travel resumes were developed. Dr. Inda is also responsible for directing, coordinating, and managing public health surveillance and response activities related to the conditions of regional and international importance. And monkeypox comes to mind as the most recent example. She's currently the technical head for CARFA's comprehensive, multifaceted regional health response to COVID-19 pandemic, working with CARICOM, heads of government, agencies, both international and regional, and national multi-sectoral stakeholders to keep the Caribbean safe and promote safe economic recovery. Please join me in welcoming Dr. Inda.
Good afternoon, everyone, and greetings from CAFA, as well as the Executive Director of CAFA, Dr. Joy St. John. So a lot has been said, and I wanted to say that we are really happy to be here in Bermuda. As Minister said, Bermuda was one of the first to launch, and we're here today. We came here this week to really revamp a program that is part of your overall health system strengthening so that we can have sustainable tourism. And because you're tourism dependent, having sustainable tourism means sustainable economies. And this is why we engage this wide range of stakeholders today, the last few days, so that we have buy-in. The Regional Tourism and Health Program, as said by the first two speakers, it's a multifaceted program, and it consists of many different areas, all geared towards building capacity for early warning and response. Why do we want early warning and response? So that we can be able to detect something quickly, so that it doesn't spread and we reduce negative reputation. We do not want to be in a situation where you have a single person transmitting illnesses and overnight it's going to large numbers. And then, it was not reported. And all of a sudden you have 500 and 600 cases that you cannot contain. So the tourism and health information system and the cruise ship surveillance systems are systems that are confidential, but geared towards getting information in real time so you can have rapid response. And those systems are supported by guidelines for response based on the science, by a suite of different capacity building, by operational standards, by policy, and by multi-sectoral partnership. And as a reward to the industry, that healthier, safer tourism stamp. And that stamp in any one of your facility, whether it be a land base, a hotel, a guest house, a villa, a restaurant, or on a ship, it says you, that particular facility, is conducting proactive health measures and are using systems of reporting to encourage health, so that the traveler or any passenger or any guests can feel safer and healthier because of these measures. So the program really is meant to build capacity at country level. CAFA, as the public health agency, our goal is to provide technical support to countries, and we're here to help. We're here to work with Bermuda. And I wanted to say today, it's a shared responsibility. It's not just health, but tourism, transport, and we will, and the many different divisions, the hotel association, the tourism association, transport and airports authority. They're all important because from a time a visitor arrives to when they leave, there can be so many gaps in the system. But more so, how do we protect the health of our local population as well? So the program we will work with Bermuda to strengthen that overall health system strengthening, so we can respond and we can have a better Bermuda, a healthier and a safer Bermuda, and a more sustainable economy.
We'll now take questions from the media. Jonathan, do you have any questions?
Just a couple. You mentioned the traveler's information system. I'm curious to hear a bit more about what that entails. That's going to be coming out over the next few months.
Okay. Yes, so the Traveler Health Information System, the TIS, is one of the platforms that CAFA has developed, and we're using to capture syndromic, basically things that people can find that would help us to understand what disease is out there, help us to control it. So give an example: if you find a passenger, a visitor, or resident who, for instance, starts vomiting uncontrollably in a bus or on a ferry, that could be a beginning of something much more sinister. So that recorded in the travel information, health information system, allows us to be able to track things and gives us early warning to put proactive measures to respond to that early. So that's the kind of thing that it's meant to do.
So if I'm involved in the tourism industry, I can spot something and use this to look up how I should respond to it.
You can report it, and then that will get looked at, and that response is put in place early. Yes.
I guess, it's obviously the COVID is still a thing, and we're hearing about monkeypox. What are some of the top concerns that we should have on our radar in terms of travelers and disease?
Okay. I'll probably let Dr. Inda start with that, and I can add to it.
Yes. Sure, the hard questions to me, Doctor. Yes. What we are seeing right now, yes, we had the COVID-19 pandemic, and we are still in pandemic phase. It's important to know that. And on the heels of that, we are seeing monkeypox. But general infectious disease on the whole, what we are seeing is almost like a revamping. And it makes sense because we wore masks for a long time. We washed our hands, we stayed apart. So it means communicable disease, which by its nature means, transmitting from person to person through shared space. That would have been on the decline, but it's now on the increase. And so we want to, for travelers, and then by extension our public, we want to encourage people to still practice healthy, safer measures. Wash your hands. That should not just be for COVID. Do it often. We are wearing masks in enclosed spaces. But, we have Cup March this week. If we are in mass gatherings, and, we should be able to cover our faces so that you reduce the risk of spread. Keep it apart if you can. And if you're in any situation where you feel that close contact is, it's too close, then it's perhaps too close. That's the whole idea. The communicable disease spreads from person to person. Viruses, on the hand, like COVID-19. And then there's another bug that's very important, norovirus. It spreads, but it stays on surfaces for a long period. So we may clean and not even realize, and it may not be enough. You have to deep clean and sanitize. So we have to keep telling people to do some of the right public health measures, and also adhere to what your Ministry of Health says in terms of how do we mitigate.
If I can add to that, Jonathan. So, Dr. Inda has talked about norovirus, which is always something that we are concerned about. It can cause quite a bit of havoc in a very short time. In addition to that, there's also some food poisoning type events, salmonella, E. coli type events. Those kind of things can cause a lot of reputational damage, a lot of ill health in a very short period of time. Apart from COVID and monkeypox, that's very topical at the moment, because we are all relaxing our measures. All the respiratory viruses that have been hiding in the past are now coming out to play. So we're seeing metapneumovirus, respiratory syncytial virus, things like that coming out. So those are the kind of things that we would like to keep on top of, not wait for the formal reporting mechanism of people going to their doctors, because by the time they go to their doctors, then it's a bit too late. We want to know things early so that we can put control measures in place.
Thank you, Gary? Yes, just to clarify the nature of this system, this is more of an observance and report system than a diagnostic system. You're training the tourism stakeholders to be able to spot and report. Is that essentially what we're looking at here?
You've got it spot on. We are not diagnosing. It's called early warning and response. The response is done by Ministry of Health. But, you have a set of people becoming ill. It's important to know, well, is this for real? If the symptoms are similar, you may think, well, if it's gastro, you start thinking very quickly. If the gastro happened very, very fast, you're looking at perhaps viral spread as opposed to bacterial. So it's a confidential system, doesn't require anybody name, because you're not looking at, the person and diagnose the person. You're looking at being able to detect something early, perhaps a cluster or any public health issue, so that you can respond.
Okay, and then what infrastructure do we, obviously in your observances, for the infrastructure for the follow-up, as in you report something and then you have to determine if it's a problem, then the diagnosis element comes in. What is our infrastructure sufficient for that?
So I could answer that both ways. One, the system is inbuilt with the infrastructure. So for instance, sometimes a person is sick and they have everything under the sun. What the system does, it's an electronic system inbuilt with case definitions, and they would fit it into that 6 international case definitions of, gastro and fever and rash and so on. And based on that, and the persons who are getting sick, when you start analyzing, it sends a threshold. And if it passes a threshold, it sends an alert. So that alert will go to select very confidential persons in ministry, who would then start a process of investigation to determine, well, this gastro may be foodborne illness. If it's foodborne illness, we should collect a sample, and samples, we should be able to collect stool samples and food samples and so on. So yes, it triggers a response, and there are very clear protocols within Bermuda, and that speaks of how do you investigate different types of illness.
Understandably, we've gotten very used to testing, being having, obviously we don't have as much PCR testing as now, but previously that was going on all the time. So we were being constantly diagnosed. So that section of it is far further down the line when it comes to this system.
Yes.
Yeah.
Yes.
What I would, are you able to give us any updates on what's happening right now in Bermuda with monkeypox? Because that's been the most recent issue. How we know that one person was diagnosed. Have any more been diagnosed?
So short answer to that is no more. That's
No.
still the same person that we still have, and we're conducting a contact tracing around them and to find out who they've been exposed to. As the people we've identified so far, we put them in quarantine, and we're watching them to see if they go on to develop this infection.
Is the person how is the person?
The person's fine. They're not hospitalized, so they're fine in that they're not hospitalized, but they're getting better now.
And just to ask, this program coming here, is it coincidental that it's happened at the same time as our first case of monkeypox, or was was it? Oh, this is something we need to do. We need to catch up with. Or
I wish I could say I had such grand plans to design that, but no. We've been planning this since April, and this is just the time that was mutually convenient for both of us.
Thank you.
Thank you. No further questions? Thank you for joining us. Thank you, Minister. Thank you, doctors. That will conclude our press conference today.